While I believe all of you would be delighted if I could tell you how to make a lightsaber and we could all be Jedis, I'm actually here today to talk about how dental lasers can be used. We're all too familiar with the stereotypes that surround dentistry. The high-pitched sound of the drill, the pain, the tangy taste of blood, and the sharp, scary-looking instruments. What if there was an alternative to all of that? One that reaches the same treatment goals, but without the endless bleeding, without the aggressive sound, without the aggressive cutting. Instead, imagine a pen that can emit a beam that immediately stops the bleeding and can also depigment gums. How many of you here tonight have had your wisdom teeth removed? Do you remember at the end of your operation, sutures were required to close the wound, and you had to bite on a piece of gauze strip for the bleeding to stop? And the next morning, you could probably still taste the blood in your mouth, or maybe there was swelling because of an infection or inflammation. This is because by using a scalpel, a normal medical knife, tissue is torn apart and blood vessels are cut open, allowing blood to continuously flow out and bacteria to enter in. On the other hand, high-power lasers like this use heat energy to simultaneously cut and solidify any open blood vessels. This means the bleeding immediately stops, the wound is closed, and it disinfects the site. This saves precious operation time for the dentist and as well provides a comfortable experience for the patient. If you lower the level of the laser, the power level of the laser, a notch, it heats and destroys certain pigments that absorb the energy released. This is particularly useful in treating patients with black gums, which is caused by melanin, a pigment that lies deep within the gum tissue. Lasers can penetrate the superficial surfaces and vaporize the melanin deep inside. Compared to using a scalpel, you would have to open up the superficial layers, the healthy layers above, and destroy the layers on top. Reduce the power level even further, and we use it for a treatment called low-level laser therapy. At this level, the energy absorbed, when it is released, the cells absorb it, and then it stimulates the cells to release regenerative molecules, which can promote healing as well as provide pain relief. The applications mentioned above are only the tip of the iceberg. Ongoing studies are studying the versatility of using dental lasers, as well as trying to reduce costs, so that in the future, we all have access to this treatment, and we can also provide the least traumatic treatment for all of you. Thank you very much.